Hello everyone, welcome to Pathomad. Today let us discuss about the gross and microscopic features of Phyllodes tumor of the breast, which is one of the fibroepithelial lesions of the breast. So let us see the introduction. This Phyllodes tumor it is most common between the age group of 30 to 70 years of age. That is, middle-aged women and older women are more prone for this Phyllodes tumor, and it arises from the interlobular stroma. Interlobular stroma. Let us see the brief anatomy, brief brush up of the anatomy. So, this is the lactiferous duct, lactiferous sinus, lactiferous duct. It branches into the terminal duct. Each of the terminal duct at the tip it has acini, a group of acini. So this terminal duct along with the acini they make up one lobule. This is one lobule, and the stroma present within the lobule is intralobular stroma, whereas the stroma present in between the two lobules, this marked in orange, this is the interlobular stroma. The fibroadenoma, which we have discussed earlier, it arises from the intralobular, within one lobule, intralobular stroma, whereas the Phyllodes tumor, which we are discussing now, it arises from this interlobular stroma. The stroma present in between two lobules is the interlobular stroma, and the Phyllodes tumor arises from this interlobular stroma. This Phyllodes tumor. It is highly cellular. It is more cellular than the fibroadenoma, and these are large and bulky tumors and fleshy tumors. These are large, bulky, fleshy tumors. They distort the normal breast architecture grossly. They are very distorting, and overlying skin ulcerations can be present. Skin ulcerations can also be present. See, this is a clinical image of the Phyllodes tumor. It distorts the entire breast. Normal breast architecture is lost. Entire breast is distorted with overlying skin ulcerations. So this is the gross image of a benign Phyllodes tumor. On this cut section, the benign Phyllodes, it is sharply demarcated. See the margins are sharply demarcated margins. Sharp demarcated margins are present. Sharply demarcated margins. And these are lobulated. This is one lobule, this is one lobule, this is one lobule, lobulated. The cut surface is firm. This tissue is firm and it is glistening, shines, and it is grayish white in color. More common is grayish white. And the benign tumors, they have pushing borders, like the borders they push into the adjacent tissues. Though they are demarcated, they have pushing margins. Whereas the malignant phyllodes, they are poorly circumscribed, poorly circumscribed. You cannot distinguish where the tumor is confined to. So they are not confined, they are poorly circumscribed. You cannot differentiate the margins, and they are infiltrating, they have infiltrating margins. I mean, if at all this is the tumor, they infiltrate in the surrounding normal tissue as well. They do not have any sharp demarcation, sharp margins you cannot identify. So this is the microscopic image of the phyllodes. It shows you the classical leaf-like pattern. This is one leaf-like pattern, large leaf. Why this leaf-like pattern occurs? Because of stromal hyperplasia. There is extensive hyperplasia of the stroma, and it compresses the epithelial lining. The epithelial lining is compressed because of this stromal hyperplasia, and because of this extensive hyperplasia, the tissue folds upon itself. This it grows, the stroma grows and it folds upon itself, and that's the reason why it creates this leaf-like architecture, and also there are huge clefts present in between these leaves. Leaf-like clefts are present in hypercilliar stroma, very characteristic of this phyllodes. You identify the phyllodes because of this leaf-like architecture. Phyllodes means leaf. Phyllodes means a leaf. And also, you find sometimes you encounter this mitotic figures. Mitotic figures are nothing but the cells shown in the cell dividing phases, like different phases of cell division, anaphase, prophase, metaphase can be seen. These are called mitotic figures. Mitotic figures are nothing but the cell dividing cell phase, mitotic figures. And if these mitotic figures, if they are less than 5 in 10 hyperfields, you check 10 high power fields, and among these 10 fields, if less than 5 mitotic figures are there, then those tumors are of benign nature. And if they're 5 to 9, between 5 to 9, they are borderline. And in 10 high power fields, if you find more than 10 or more than 10 mitotic figures, then those are benign malignant Phyllodes tumor. This is all about the gross and microscopic features of Phyllodes tumor. Thank you.